Hi guys, it's Sheena from Teton Raptor Center and I'm here to give you all this week's patient update. So let's go ahead and get started. First up this week for our current patients in our rehab facility is Cooper's Hawk 12-5, and this bird came in from Green River, Wyoming. We believe that it was dealing with a potential window strike injury or a car collision, but we're unsure specifically what exactly happened to this bird. However, he did come in with some mild head trauma and is being treated with anti-inflammatories and is responding really well. He's eating on his own and is really strong and active, so we actually moved him out of the ICU and into the PCU. So things are looking really good so far. Next up, we've got Bald Eagle 12-2, and this bird came in from Georgetown, Idaho after being struck by a vehicle. She's dealing with some pretty severe head trauma as well as a broken left wing. As you can see in this photo right here, she's got that blue bandage around her wing. It's actually her ulna that has fractured, and luckily that bone actually does not need to be surgically repaired, just because we can use her radius to act as a splint and allow that bone to heal in alignment. And since the ulna fracture is a nice midline fracture and looks really clean, we don't really have to worry about any issues as far as infection or malalignment during the healing process. Another really cool thing about this bald eagle is that she must have encountered some trauma at a younger age, because it appears that her beak had once been fractured. However, it is fully healed, and when she did come to us, her beak had grown out and was actually quite long. This is after we had coped and trimmed her beak. We basically just use a Dremel and some big nail clippers, and hopefully over time we can get this beak back into shape. Last but not least, for the birds that we're going to be covering in this week's update is Short-Eared Owl 1122. This bird came from Newcastle, Wyoming after being hit by a car and suffering from a dislocated elbow in her right wing. The tricky thing with these dislocated elbows is that if they're not popped back into place within the first 12 hours of injury, they often don't heal ever, and the bird will never be able to fly. However, we were fortunate to have found someone that turned this bird in very early to a vet clinic, and we were able to get it swiftly into our care, have its wing corrected, and she was in a wing wrap for 2 weeks when she first arrived, and then had full cage rest, wasn't allowed to fly around using those wings to make it worse. And now we were actually able to take the wrap off just a couple days ago and begin physical therapy. So we're moving in the right direction and things are looking really good so far. All right, that's all we've got for this week. Thank you guys so much for tuning in, and I look forward to talking with you all next week. Remember that if you want to do your part to help keep wild birds wild, you can check out our website at tetonraptorcenter.org and make a donation. Bye!